Yes, us. Welcome to the Kefi Life podcast. My name is Kiki Vale, and I'll be your guide to creating a life of Ola Kala, all is well. Together, we'll get back to the basics, and we'll explore fresh new ways to flourish in mind, body, and soul the Greek way. You can look forward to interviews, stories, essential self-care strategies, recipes, and actionable takeaway Ola Kala moments. This is going to be so much fun. Let's get going. Πάμε! Lexi, for today is Ωmos or shoulder. A healthy Ωmos tip for you today is this. When you're stressed, nervous, or agitated, be mindful of your shoulder position. Are your shoulders up by your ears, tense, or sitting softly on your frame in a relaxed state? Make sure to check in throughout the day for how your shoulders are placed. Pay close attention to your shoulders when you're typing, sitting, or in an important meeting. Keep the Ωmos comfortable and loose to maintain good posture and well-being. Here at Kefi Life, we love the sun. We're what you call heliophiles, lovers of the Helios, or the sun. We adore the vitamin D, the warmth, and the light of the Helios, but we especially like the glow that the sun provides our skin. Now, friends, we can all get our Grecian glow on when we visit a very talented artist in Hinsdale who custom sprays with no chemicals or cancerous side effects.
Hi, I'm Justine, owner of Bronzed and Beyond, located in downtown Hinsdale. I'm a custom airbrush tan artist with 3 years of hands-on experience and over 1,000 satisfied clients. I deliver flawless, natural-looking tans that enhance my clients' features and boost their confidence.
You can look like a golden goddess with Justine's expert custom spray tan. Find this cutie pie at Bronzed and Beyond, located inside Lux Brows and Beauty in downtown Hinsdale. Call 630-999-3712, and you can schedule an appointment. Again, that's 630-999-3712. Mention Kiki, and you'll get $5 off. Bronzed and Beyond, bringing you the Ola Kala glow that you deserve. Yes, us friends, I love when you take time to check out Kefi Life, the podcast. I know you love us because we just turned 4 and we have almost 50,000 downloads. Thank you so much, friend. We couldn't do it without you. Each episode we create with love and also to help you achieve a balanced mind, body, and spirit. And today, our concentration is on mental health. We're bringing back a popular guest, BSN RN Yianna Papadeas. Try to say that 3 times. I love how that sounds. Seriously, friends, for today's episode, we're calling it Mental Health Awareness Tips from a Psych Nurse, Yianna. Yianna, welcome back.
Hi, thank you. I'm so happy to be back. It's been a minute, but I'm very happy to be here again.
You look wonderful. Tell us what you've been up to lately. You've been doing big things in the nursing
Yeah, for sure. So since the last time I was here, which was a few years ago, I was working inpatient psych, which was my patients would come to me on holds for either danger to self, danger to others, or gravely disabled. I kind of shifted a little bit into the forensic psych population, which is a very specialized demographic and kind of where I kind of found my niche. It's like I'm very passionate about it, which was kind of surprising, but I was a charge nurse at a state psychiatric hospital where my patients would actually come to me from prison because they'd been deemed incompetent to stand trial by reason of mental illness or insanity. And so they would come to me from prison and then they would go through what's called restoration treatment, which is where the judge had deemed them that they needed to go through restoration treatment to be competent to stand trial. And then once they were deemed competent, which could take months to years, they would then go back to prison until their trial date. So it was a very, very specialized demographic that I really, really fell in love with. And I was kind of surprised that I loved it so much, but I loved running that unit, and it was very, very high acuity, which kind of made my job before that look kind of easy, which is kind of wild for me to say that because my other job was very high acuity as well, but this specifically was even more so. And then I actually started psychiatric mental health nurse practitioner school. So I'm pursuing my master's right now, pursuing kind of the next level for me to get to the point where I can evaluate, diagnose, and treat my patients, which is, what I want. I want more autonomy with my patients. I want to be the one building the treatment plan and carrying it out, as opposed to just kind of doing what I'm told with my patients. I want to be the one that's working with my patients to come up with their treatment plan. So that's kind of next steps for me. Been doing a lot. I love what I do again, and here I am. Yeah.
I love that you are going to work with people in the facet of healing them and trying to find a root problem because we have to go deep into the root, and that takes work and that's not easy to do. So I have 2 questions for you right out the gate. I have like a lot of questions because we're really going to try to help people in the general population to stay positive and really keep their mental health in check. But the first 2 questions, since you brought this up, is what do you mean by acuity? And next, what is it that draws you to this very difficult area of nursing in the forensic unit?
Mm-hmm. Yeah, for sure. So acuity is kind of how we gauge levels of care. So somebody that would be in an inpatient level is somebody that needs kind of the highest level of stabilization. So my patients, and I've always liked and preferred working with the highest level of acuity, meaning they need the highest level of stabilization. So an example of that is somebody that comes in and they're basically so psychologically sick that they need help being stabilized to literally take care of themselves, or they're so suicidal that like it impairs with like their daily like levels of functioning. So that is what it means by level of acuity. Like there's different levels. If somebody's a lower level of acuity, they wouldn't need inpatient care. They wouldn't need 24/7 care, 24/7 watch. They could be somewhere, it could be an outpatient care, for example, which is like 3 days a week where they go in, check in with their psychiatrist, go to group therapy, and then go home. Whereas an inpatient setting where I am, we have to do 15-minute round, like we have to round on our patients every 15 minutes to make sure that they're okay. If somebody's on a 1-to-1 status, they have to be watched 1-to-1 every second of every single day for 24 hours a day, unless a physician says it's okay for them to be taken off that level of observation. There's just a lot more resources for people to become more stabilized when they're at a higher level of acuity, because there's more staff and more ways to care for them and help them become more stabilized. And then hopefully we'll get them to a lower acuity level, like outpatient, and then hopefully like get them home to like where they want to be. And then your next question was, I'm sorry, what was your next question?
Okay. That was a really good answer. My next question was, because to me at first hearing that, it sounds very taxing and also exhausting to keep an eye on somebody who could like go down the deep end at any moment.
Yeah, they can be.
And so what is it about that aspect of your work that you're really drawn to that you can help them?
Yeah, that's what you asked about the forensic side. So the forensic side specifically, I mean, I've always been very passionate about working with psych patients. I think they're a very underserved population in general, and I think they're a very misunderstood population. I think people unfortunately in general have a very like negative predisposition towards that population of like, oh, it's like, quote, always like the crazy person yelling at the sky down the street that I just want to stay away from. And I always try to conceptualize it better for people in the sense of like, no, like my patients are very, like, they're just people dealing with normal things that you go to the doctor for to check for like your heart problem or your broken leg or whatever. And people just have the same things that they deal with and manage. And they're your coworkers, they're your teachers, they're your friends, and you wouldn't even know about it necessarily. But for whatever reason, I mean, there's lots of reasons that I could go into, but there's a negative stigma attached to it for people seeking like mental health support and help. And when my patients get the help that they need, they can go back to living their lives the way that they want to and go back to their jobs and go back to their families and, you know, live the life that they are choosing and trying to live without, you know, hopefully the stigma that they don't want following them, which is why I care so much about that. But I think the forensic side is very interesting to me because it brings in kind of the criminal aspect of it and the law aspect of it that I didn't have experience with. So I've learned a lot about the law, which has been very, very interesting. And I've just learned a lot about just a lot more of like prevention care, I think is really important. I'm very passionate about like, how can we prevent somebody from getting to the point of being in an inpatient setting, and what do we need to do before they get to the point where they're my patient for years and years and years? And what can we do from like even a young age before they get to that point of, I'm sorry to say, but sometimes like point of no return of like, Aww. There's not much we can do for some people, not everybody, but like some people, especially when they're in the system for so many years, there's like sometimes like not a lot you can do for some of these people. So I think that specifically has made me very passionate about the forensic side of nursing. So yeah.
And what you just said was really heartbreaking, that somebody might not make it out and that they may not get the attention that they need. Yianna, how has the conversation around mental health shifted over time? I know this is something that you're interested in, you're observing.
Yeah, I think it's really interesting. And I think it's kind of like a double-edged sword because I think especially since COVID, the conversation was brought up in a very positive way of people not dismissing mental health topics, because I think everybody kind of really was more open to hearing about people's emotions and validating people's emotions and hearing about how are you feeling, how are you doing, and kind of like checking in on each other more and their friends and family, which I think was a huge positive aspect, like one positive thing at least that came out of the pandemic. But I think what I've seen personally has started to come in the years since that is kind of this oversaturation and kind of like buzzword mentality with like mental health things of kind of overdiagnosing and people self-diagnosing things. And I've seen it a lot with social media, and I've seen it a lot with a lot of the youth, especially a lot of my adolescent patients. And I'll give you an example. Like I'll have a patient that will say like, oh, my boyfriend broke up with me. I have major depressive disorder. And it's like, okay, well, to have a mental health diagnosis, you have to fit a very specific set of criteria. And that's sad, and that's heartbreaking that like your boyfriend broke up with you, and of course that's like a life stressor that you're going to have some feelings, some difficult feelings about. But there's a difference between life stressors and managing life stressors and how you manage that, and then whether or not you fit certain criteria for an actual mental health diagnosis. And I think that there's like an importance of differentiating the two, because the problem with self-diagnosing and oversaturating things is it can lead to over-medication and also like an inability for people to build positive coping skills. And that's something that I've really, really seen in my practice is like a lot of my patients these days and of every age have no positive coping skills. So a part of like my treatment with a lot of my patients is building positive coping skills with the support of the staff while they're in an inpatient setting. Because what I kind of tell my patients is, look, you're always going to have something difficult in your life that's going to happen. There's always going to be that next thing that's going to stress you out. But how are you going to handle it? And especially with my detox patients, like their crutch is drugs or alcohol, and they want to drink or they want to do drugs. And something we work on is we need to substitute that for a positive coping skill, because that feeling is never going to go away. You're always going to probably want to go to that substance. But what are we going to change that out with as something positive that we can work together with while you have the supportive staff, so that when you leave the inpatient setting, you have something else that you can focus on that's not a negative coping skill, that's not going to land you back in an inpatient setting where you're like fighting for your life, and we can like set you on the path that you're trying to go on.
Yianna, I can feel your passion with this. Yeah. I mean, when my mother was sick in the hospital at the end of her life, it was the nurses that really tugged at my heart. And I have all the respect for doctors, but I don't even want to get teary-eyed right now when I tell you how unbelievably special it is to have a nurse like you helping a person, one, feel confident like there's hope. And it's because of your passion, you're listening, you care, and that's really a gift. And I want to, first of all, say congratulations, keep going on that.
Thank you. I appreciate that.
I mean it with all my heart. It's really a gift, and to have people like you in the world is very, very important and special. Before I jump to the next question, because I have a number of other questions, you mentioned coping. Let's do a general population thing with coping skills. What are maybe 3 coping skills you can think of? I know that's kind of general, but because coping is a problem, like when something comes up, how to have like 3 strategies or a couple strategies to kind of help us with that coping.
Yeah. And I will say, because I feel like that's another topic that can get kind of oversaturated. And I know, and I'm not like knocking the social media world, where I see a lot of things on like Instagram or Facebook that are like, your self-care should always be like taking a bubble bath or going to get a massage or doing this. And I'm not knocking those things, because like, of course, even I want to go get a massage or like go get my nails done or whatever. Like those are not bad things. But that's another differentiation I think that needs to be made between like positive coping skills and things that are just fun to do. I think that still qualify, I think, under self-care, but like, for example, my patients in an inpatient setting in the hospital, they're not going to get a massage. They're not going to get their nails done. So like those things cannot be their positive coping skills that they can use when they're really down and out and they're really trying to rebuild their life. So things that I try to work on with patients when it comes to positive coping skills, when they're really kind of at rock bottom, is like first of all, not relying on anything else, because you need to be able to use your positive coping skill without having to rely on anything or anybody else but yourself. So a big thing is I like grounding techniques with my patients, and it works for some of them because a lot of them have a lot of PTSD, a lot of just just a lot of like trauma in their history. And a lot of them just have a lot of anxiety that they carry, and a lot of like regrounding to reground them to where they are, especially with also like my schizophrenic patients, like if they don't know exactly where they are and they want to like, just to help like reground where they are. So like regrounding, doing like a full body scan can be a really good one to kind of just like basically go from your head to your toe and really feel present in your body of like, I feel my head, I feel my shoulders, and drop your shoulders down, and I feel my stomach, and is my stomach knotted up, or what does my stomach feel like, and kind of like telling yourself or having yourself relax each part of your body from the head down. That's not something you need any material for. It's not something you need another person for necessarily, and it's something that you can do anywhere, anytime, any place. So I would say something that's like a regrounding technique. That's just one example of one. Another one that works for a lot of my patients is like meditation and or mindfulness. I will say a lot of my patients personally don't like that until they get a little bit more stabilized. And I also think like meditation is like a lot more difficult than people think it is. Like even I've like struggled with it. So I think that's like an interesting one. And then I think another one would just be like any type of physical movement. There's been so much research that shows that even with trauma, like we have to like release the trauma that's stored in your body. And so with a lot of my patients, like I always advocate for some type of group during the day of any and all type of movement, whether it's even if we're inside still because it's cold in Colorado, like some type of body release movement of any kind, even if it's like dancing to music. And that's something that I love to with my patients. Like some of them will do karaoke sometimes and then they'll start dancing. And that's one of my favorite things with my patients because it's often the times I see them like feel their most normal selves. And that's what they'll tell me is because they just really like listening to music and dancing and just being in their own world. But I also think it's really healing for them. And it can really just help release some of their bad energy that maybe they might be feeling at the time.
This is something that I feel I'm kind of homeopathic, so I don't have your experience or education with in the medical field. But it feels like sometimes that's why I wanted to bring you on, that the mental, I'm just going to use, for the lack of better words, baggage, the mental hardship and things that are going on in our head can manifest into our bodies and really make us sick. Mm-hmm. And that's why I believe in what you said about dancing and movement and just sort of kind of bringing yourself back and feeling a little bit of joy and kind of getting rid of some of that stuff. I don't know if you heard the story about the man, he was Greek, who was told at the age of 45 that he had cancer and he was going to die within months. And he moved back to his birth origin, which was Ikaria, Greece. It's a blue zone. And he's like, well, if I'm going to die, then I better go where I'm going to have a nice time in the end. Anyways, 1 year goes by, he's drinking wine, he's playing davli, which is backgammon. He's going and seeing his friends. He's walking up the mountains. Another year goes by, he's eating those delicious tomatoes. He's doing all these things in nature and he's helping himself just get reacquainted with friends. He lived till he was about 95.
I'm not surprised by that story at all.
Really?
No, I have not heard that story, but it doesn't surprise me at all because I really think your environment matters so much. And I'm also a big believer in trying a lot of things first before resorting to medication. But I'm also a believer of like, I also have seen medication work very well. So I think if you are going to go the medication route, also like having the medication in conjunction with other like therapies as well. So I don't think my personal philosophy is don't just have medication and not have anything else on board. I'm not a believer in that. I think I'm very holistic minded in the terms of everything affects everything physically and mentally, and you can't have one without the other. And you need to treat the whole mind, soul, and body in order to like have any type of progress with anything, because your mental is going to affect your physical and vice versa. So
I might have to use that. Everything affects everything. I couldn't agree with you more. That's really good. That's really good. Do you think that urbanization contributes to the deterioration in mental health? Meaning when we get away from nature and we're in these big cities with the big tall buildings and we're not seeing the grass and the flowers and all that. Do you think that is harming us?
I think it is for sure. And, oh man, the first thing that just popped into my mind when you said that is, and this is just because my work life, like that's the first thing that pops in my head. But they actually just passed a law in Colorado that my psychiatric patients can have their phones while they're going through treatment, which was never a thing before. I don't know if other states have passed it. But the difference between my patients and their care before and after having access to their phones has been like monumentally negative. That's just one example. I know you're talking about like not just like technology, but just everything as a whole. I think that's just one example of us getting away from nature and like staying inside and staying on our phones and staying on our tablets and like staring at a screen for 10 hours a day. And that's another reason why I advocate for my patients going outside as much as possible. I 100% think it gets us like out of whack, because I think biologically we were made to be outside and be interactive with other human beings, and we weren't made to be inside all day and on a computer and not interacting with humans. And I don't think it's like natural. So as much as we evolve and there's good things that come out of technology and all these things, I don't think it's still innately natural for us. So I do 100% think there is a deteriorating aspect of that as well, especially with the adolescents. I've seen I personally believe, I don't know exactly like the stats and numbers on it, but I personally believe like anxiety and ADD and all these like attention span things like have like short attention spans have gone through the roof because of like things like social media, and kids don't even go outside and play anymore. And they can't like focus on things for a certain amount of time. And so that has led to a big thing with like adolescents coming in for different mental health struggles when it comes to just that alone as it is. So I think there's a lot of different ways that's impacted different generations and different ages and different people. But I 100% think it's definitely impacted the mental health of our world for sure.
It's Mental Health Awareness Month, and we're talking to Yianna Papadeas. She is a BSN, and she's working on her master's in psych nursing, and she's got a ton of experience and a very compassionate young woman. She's here today to talk to us about mental health on a very deep level, but also maybe a generic level. So let's talk to the mass audience. I don't even know. Maybe there's a lot of people out there that are kind of like at the bottom, or, rock bottom. And then there's some that are just fighting and trying to pay their bills. And then there's some that are, just out of a rut. But anyhow, let's just kind of look at this in a holistic situation. What daily habits or rituals would you recommend yourself, Yianna, to protect someone's mental health? What would you tell someone?
Yeah. So something that I personally like, and again, I do with my patients, like, I'll just say that because I'm not going to recommend something that I personally don't believe and haven't also seen work with my patients that I work with on a daily basis. But something I like to work on with my patients is like a gratitude journal. And I don't even like saying journal because, again, like when I have my patients that I'm caring for, they sometimes don't have the capacity to even journal like a lot. And they honestly a lot of times don't want to. So sometimes I'll break it down for them in terms of like even just writing one thing they're grateful for, or like maybe even 3. And that's like their gratitude journal for the day. But I really do think there is something to focusing on the positive. I really do believe that, like your thoughts can shift your whole entire mentality and all these things. And so I do believe that is a big part of any type of treatment plan. And I'm not saying like, don't acknowledge any of like per se, like trauma that needs to be addressed or anything like that. Like that's not what I'm saying either. But I think as much as we address negative things within a care plan, we also need to address positive things and positive things moving forward. Like there needs to be a balance. And I think a lot of times with psych, like a lot of, I've just seen this in my practice. I've seen a lot of too much focus on negative things, like, well, what happened and what brought you here? And again, it does need to be addressed, I believe, because you have to address what brought you here and how we're going to change that and how you don't end up back here again. But then sometimes not enough on positive things. Like, what are you grateful for? What can we look forward to in your life? Like, what do you want to work towards, and goals and like actual goal setting? And so that's a big thing that I like to work on with my patients is like, what are you grateful for? Even if it's just one thing, even if it's just one thing today, that's totally fine. So I think that's a big thing that I've seen have a positive shift with my patients' mentality throughout their course of treatment, that I've seen work well. So I think that could be a good daily habit, even just for whoever's listening, or honestly anybody. And it's something that I like to do in my practice too. In my own daily life, I'll just try to write down one thing, because I get it. Days are busy. I personally don't like to journal a lot. I'm not a big writer, so I don't like journal a whole book. I just like to write sometimes, like every day, like one thing, literally just one thing, and that's all.
Excellent. So out of your head and onto paper. I love it. And also sometimes when we write it down, we realize like, oh my God, I do have something to be happy about. Yeah. All right. It's just gone way too fast. I guess we'll have to have you back. But as we wrap up, Yianna, first of all, it's just a pleasure to see you. Yeah. And Yes, and you just keep making a difference in the world. In the end here, is there something you've learned working with the people that you've worked with, whether they have a mental situation that needs improvement or otherwise? Is there any advice that you give people that could truly make a difference or help that person?
Yeah, I mean, big question. I think there's a lot of things that come to mind when you ask me that, and I think I've mentioned a little bit before. I personally am very big believer in prevention and also just openly and honestly talking about this discussion. But I think I don't have any kids, but if you have kids, I think talking about these things from a young age and prioritizing your kids' mental health from a young age is a very big deal. And I think those are the types of things that will help kind of, again, like prevent people from getting to the inpatient setting like where I'm working, and like if you can help your kids build one positive coping skill for the rest of their life, I feel like they have a better chance of like making it than a lot of other people may not have. So I think that would be like my advice is like, or not just your kid, like if it's for you, if you can really hone in on one positive coping skill that you feel like can get you through anything, like I think that's a very big deal. And a lot of people kind of maybe take that for granted if they have a lot of good positive coping skills. But I think a lot of times the difference between people that haven't been in an inpatient psych setting and people that have is that sometimes we just cope better because we all have difficulties, we all have struggles, but sometimes the difference of what lands someone in an inpatient psych setting is just that they negatively cope and they don't have good coping skills. And that's the only difference. They're still a person, they're still doing the same things and dealing with the same struggles, but they just like have a negative coping skill. And it's only that difference. So if you have a positive coping skill, it might make all of the difference for your whole life. So that would be my advice.
There's always hope, and there's always a way to find out how we can improve our mental health, which will affect our physical and our spiritual health. And you have been a sheer delight. Yianna Papadeas. I just like saying that. But what do your friends call you, Yianna?
Yianna, yeah.
Yianna. Okay, well, listen, you go on and you have a great day and know how much we appreciate you here at Kefi Life.
Thank you so much. Thank you for having me.
Yamas, today I'd like to personally invite you to sign up for my Tuesday newsletter. Why? Because here I will directly communicate with you, sharing additional wellness content and promotions that our team has created for you in mind. I promise not to overload you, only further inspire you. Visit KefiLife.com today, sign up for the Tuesday newsletter, bringing you one step closer to Ola Kala, all is well.
Kiki is the founder of Kefi Life. She is passionate about whole person wellness and living a fulfilled life. Her Kefi Life podcast is created to simply and naturally help you harmonize the mind, body, and soul the Greek way. Visit KefiLife.com and check out Kiki Vale on LinkedIn and on Twitter. Join us again next time for more positive energy and inspiration on Kefi Life.